Hello guys, welcome once again to my YouTube channel, and today we are going to be continuing our series on STDs. So today we are going to be talking about one of the most popular STDs known as syphilis. So syphilis is a sexually transmitted infection caused by a bacteria known as Treponema pallidum. Now, people can have it without showing any symptom of it. Sometimes this could even go on for years and you would never know you have it. Okay, remember I talked about this in my previous videos and is known as being asymptomatic. Okay, so the first sign of this is you could actually have small painless sores in your mouth, in your private parts, and they could actually be, not itchy, just there, and you would never know. And after a while, it would just fade up. Okay, so now people that like to kiss too much, if those sores actually appear in your mouth when you kiss, you transfer them from one person to the other. So people just keep contacting this syphilis even without sexual contact. Even if it's called sexually transmitted disease, it doesn't mean that it's only through sex that you can get this. With common things as kissing, it could actually be transferred. Then you also have sharing toilets. When you share toilets with people who are infected with this disease, supposing they have a sore on their private parts or on their bum or on their anus, when you go back, most of us that have poor hygiene, when you don't clean the toilet seat or lace it with tissue before you sit down, especially a public toilet facility, you could also come in contact with this. Then those of us that like to do borrow pose, we borrow clothes and then we share them, panties, bras, tights, generally underwears and even trousers. Be careful because you will contact this disease without looking back. Okay, even sharing your kitchen utensils like spoons, cups, plates, you could also get it. So don't feel it's just limited to just kissing. No way. All right, so we have stages of syphilis. I'm not going to waste your time so much. I'm just going to go straight to the point. Sorry, I'm being a little bit too fast, but I think we need to maximize our time. The stages of syphilis, we have primary, secondary, latent, and tertiary. So for the primary stages, this is where symptoms shows up after a few weeks. 3 weeks, 4 weeks after contracting syphilis, symptoms shows up. If I would even prefer if everyone had this primary stage, because it will make it very easy for the doctors and healthcare workers to treat. Secondary stage, where we have skin rashes, the sores, sore throats, headache, fatigue, weight loss, and just to mention but a few. Now, without treatment, these symptoms can actually disappear. If you know, in Nigeria, we like to generalize things so much. Every little thing, oh, it's typhoid, oh, it's malaria, oh, is this, is that. Could actually be a symptom of something else which you do not know about. So please, I would like to advise you to always run a test to be sure. Let's stop self-medication. Is wrong. All right, for the latent, no symptoms at all. So the person could actually be infected with this thing for years, up to 4 5 years, and nobody will know that he or she has it because it's not showing any symptom. The person is actually asymptomatic. In another health term, is called being a healthy carrier. Now, the last stage is referred to as the tertiary stage, which could also consist of now the later complication of this particular disease or infection, which is known as blindness. Sorry, we could also have complications of blindness, deafness, mental illness, memory loss, heart diseases, neurosyphilis, and even in some cases, stroke. So we all have to be very, very careful. If you have some of these symptoms, please, you need to run some tests. Go to the hospital, go to a diagnostic center or a medical lab and run some tests. Okay, so don't just go to the pharmacy and then tell the pharmacist, "Oga, I beg mix drug for me." No, it's unacceptable. Please, we need to stop that, and that's the aim of my videos, to enable people be aware of whatever is happening around their environment and to educate people. So please, we need to move forward. Enough of this moving backwards. Okay, so if you're pregnant, or let me say if you feel you're pregnant and you're noticing these symptoms, please also rush for a test, because it could be very, very harmful to you and your unborn child. Now, if you deliver this child, as I've already said in my previous videos, women could actually transmit this to their newborn babies through delivery and through sometimes just through pregnancy. Of course, you know that the umbilical cord links the mother and the child, so things could actually transfer doing that. Okay, so now when you give birth to your baby and you have untreated syphilis that has really stayed a long time, the baby could have congenital syphilis, which is very harmful to the newborn. So we have other complications associated with syphilis. Now we have miscarriages, we have stillbirth, we have premature birth, we have deformities, we have seizures, we have swollen liver or spleen. We also have jaundice. It's not jaundice, okay? It is jaundice. All right. Now, even this syphilis can lead to further complications. It can damage the bones, it can damage the teeth, it can damage the ears, even the brain too. So if you have syphilis, let me tell you one other secret. Let me just leak the secret out to you. If you have untreated syphilis and you keep going on with unprotected sex, you are liable to contract HIV and AIDS. Actually, to eventually get blown to full-blown AIDS, and that's the end for you. So you need to be careful. Be warned. All right. Now you need to protect yourselves. How do you prevent yourself from doing this? By sticking to one partner, by using dental jams whenever you want to do your oral sex, and the rest. Use condoms. Now I'm going to center this on the married people. Please, single people, I didn't ask you to go around having sex from one person to another. No, whatever I'm saying here is for the married people and the married people alone. All right, is that understood? Now for the women, please, if you suspect your husband is cheating on you, kindly do not involve in any physical activity with him. Okay, do not have sex with him. If you must have sex with him, insist that he gets tested before you people start doing whatever you want to do, or please let him use condoms. Thank you very much. All right. The same goes for the women too. Nobody is exempted from this. Okay. Now the same thing. Let me just link this for people who want to get married. Please, if you want to get married, you want to tie the knot, kindly go for tests before your wedding to satisfy or to certify, beg your pardon, that you and your partner are free from any kind of disease whatsoever. Let me warn you beforehand, if you have untreated diseases, you could also go at a risk of becoming infertile, becoming barren, becoming impotent. So at that point in time, you and your spouse to be have yourselves to blame. Kindly carry out some tests like the genotype test to know if your blood cells are compatible. Now I'll talk on that much later. That will be a different topic. But you also need to know your blood status, if you have HIV, hepatitis, hemophilia, all these things. Then carry out tests concerning STDs, urinalysis, urine culture, urine MCS, all those tests you can think of to make sure you and your partner are free. Okay, we've come to the end of today's video. Thank you very much. Please like, subscribe to my YouTube channel, and make sure you share this to your friends and family. Make sure everybody gets educated concerning all this. Thanks. Bye.